These are the top 5 tests that your doctor should be ordering, but they might not be. Number 1 is vitamin D. Many of us who live in the Pacific Northwest, even in parts of the country where there's sunlight, are deficient in vitamin D. A lot of people think just because they're in the sun, they're getting adequate amounts of vitamin D, but depending on the way the sun's rays are hitting the earth, even though you're out in the sun, you still may be vitamin D deficient. Vitamin D is extremely important when it comes to seasonal affective disorder, anxiety, depression, and even erectile dysfunction. Number 2 is an advanced lipid panel. Many of us are familiar with our typical cholesterol tests, good cholesterol, bad cholesterol, but we're understanding more and more that testing for inflammatory markers and the size of the cholesterol particles is even more important when assessing the risk for cardiovascular disease. Number 3 is a thyroid panel. Some doctors only test for TSH, or the thyroid stimulating hormone, but it's just as important to test for the active thyroid hormone as well, which is T3, and the inactive form, which is T4. This can give your doctor a better picture of how to diagnose and assess thyroid disease. Number 4 is testosterone. This isn't just a male hormone. Females have testosterone as well. In males, we know that your testosterone levels decline after age 30, but many females experience some of the same symptoms as males when it comes to low testosterone. These include poor libido, easily fatigued after exercise, sexual dysfunction, brain fog. There's a myriad of symptoms. So getting this checked is really important when it comes to anti-aging and longevity. Number 5 is hemoglobin A1C. This is the actual diagnostic test to determine whether or not someone has diabetes. In a typical blood panel, you'll see blood glucose, which kind of gives you a peek into the window on how your body is regulating blood sugar. But if you want a definitive diagnosis on whether or not you have diabetes, you should ask your doctor to test hemoglobin A1C. Some honorable mentions are vitamin B12, magnesium, and an iron panel.